Hello, and welcome to the JCO Precision Oncology Article Insights. I'm your host, Jiasen He, and today we'll be discussing the JCO Precision Oncology article, Somatic Mutation Profiles of Colorectal Cancer by Birth Cohort by Dr. Gilad and colleagues. Early-onset colorectal cancer is defined as colorectal cancer diagnosed before the age of 50. Several reports have suggested that early-onset colorectal cancer has unique characteristics. Compared with late-onset colorectal cancer, early-onset colorectal cancer cases are more commonly found in the distal colon or rectum, tend to be diagnosed at more advanced stages and more display unfavorable histologic features. Although the overall incidence of colorectal cancer has declined in recent decades, the incidence of early-onset colorectal cancer continues to rise. This increase appears to be driven by birth cohort effects. The reasons behind this rise remain unclear, but likely multifactorial, involving changes in the demographics, diet, lifestyle, environmental exposures, and genetic predisposition. At the same time, studies have shown conflicting results regarding whether there are differences in the mutation profiles between early onset and late onset colorectal cancer. Therefore, it is crucial to explore whether colorectal cancer somatic mutational landscape differs across birth cohorts, as this could provide important insight into generational shift in colorectal cancer incidence. To address this question, the authors conduct a retrospective study to categorize the mutation spectrum of colorectal cancer across different birth cohorts. Consecutive colorectal cancer patients who underwent somatic next-generation sequencing at the University of Chicago Pathology Laboratory between 2015 and 2022 were retrospectively identified. Tumors were tested for 154 to 168 genes and categorized as either microsatellite stable or high, according to established thresholds. Patients with hereditary cancer syndromes or inflammatory bowel disease were excluded. Participants were then grouped into birth cohorts by decades, as well as into two major groups, those born before 1960 and after 1960. Genes that were identified in at least 5% of the sample were selected and grouped into 10 canonical cancer signaling pathways. These genes and pathways were then included in the analysis to explore their association with colorectal cancer across different birth cohorts and age group. A total of 369 patients were included in the study, with a median birth year of 1955 and a median age at colorectal cancer diagnosis of 62.9 years. 5.4 were identified as heavy microsatellite high tumor. The median tumor mutational burden was 5 mutants per megabase for microsatellite stable tumors and 57.7 mutants per megabase for microsatellite high tumor. Patients with microsatellite high tumors tended to have earlier birth effects and were diagnosed at an older age. However, after adjusting for potential confounders, neither birth year or age remained statistically significant. Similarly, after controlling for confounders, no significant associations was observed between birth year or age and mutation burden. In this cohort, APC, TP53, and KRAS were the most frequently mutated genes. No statistically significant differences in the prevalence of gene mutations were observed across birth cohorts. Correspondingly, the most affected signaling pathways were the Wnt TP53, RTK, RAS pathways. Similar to the gene level finding, no significant differences in the prevalence of these pathways were identified among birth cohorts. When examining patients born before and after 1960, the author found that the older birth cohorts were diagnosed at an older age and had higher tumor mutational burden. However, no significant differences were observed in any of the gene or pathway analyzed. Among microsatellite stable tumors, 18.3% were classified as early-onset colorectal cancer, while 81.1% were late-onset colorectal cancer. Consistent with previous report, early-onset colorectal cancers in this cohort were more likely to be left-sided and more common among more recent birth cohorts. However, no significant differences were identified in any of the examined genes or pathways when comparing early-onset to late-onset colorectal cancer. In this cohort, a higher prevalence of early-onset colorectal cancer were observed among more recent birth cohort, consistent with previous reports. Still, no distinct mutational signature were identified between the early and the late birth cohorts. The author proposed that the lack of distinct mutational profile by age or birth cohort may be due to the limited number of key molecular pathway driving colorectal cancer. Although environmental exposure likely differ across generations, the downstream effect may converge on similar biological mechanisms, leading to comparable somatic mutation across cohorts. Alternately, they propose that the observed birth cohort differences in colorectal incidence may be driven by distinct mutation signatures, epigenetic alterations, or change in the immune microenvironment rather than variations in canonical gene mutations. As the author noted, given the retrospective nature of this study, its modest sample size, and the predominance of advanced stage tumor, larger prospective studies are needed to validate these findings. In summary, this study found no significant differences in the mutational landscape of colorectal cancer across birth cohort or age groups. The author proposed that the generation shift in colorectal cancer incidence is unlikely to be driven by change in the underlying tumor genomics. However, larger prospective studies are needed to validate these findings. Thank you for tuning in to JCO Precision Oncology Article Insights. Don't forget to subscribe and join us next time as we explore more groundbreaking research shaping the future of oncology.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.